Hi, Russ Toronto, and this is Ashley, one of my assistants here. We're going to go through the exercises we use to help strengthen the quadriceps muscle for various kinds of knee issues. As we do these, they should always be done painlessly, and some are easier than others. There's 3 exercises we're going to review. These are mainly exercises to strengthen the inner part of the thigh that helps to control the kneecap movement. They're called the VMO exercises, vastus medialis, and that's again the muscle that sometimes when people have surgery or if they have a little weakness in their quadriceps, this is the most commonly injured or atrophied muscle that happens as a result of any trauma. And so as we do these exercises, again, make sure you stay painless when we do them, but some of these should be able to be done with any kind of knee injury as a starting point, and then we'll get into more advanced exercises after these. Now, the first exercise we're going to do is called an isometric quad set. And so there's no movement involved in the knee, so pretty much any injury you can start with this exercise. All you do is roll up a towel or pillow, put it behind the knee that you're going to exercise. So I'm going to use my fist behind Ashley's knee, and what she's going to do is keep her heel on the table and her rear end on the table and squish my hand down. So go ahead and push hard and tighten the muscle up when you're doing that. So you should feel this tighten up here. Hold it for 5 seconds. Squish as hard as you can. Your knee should stay slightly bent with whatever you're putting behind it. Hold it for 5 seconds, then relax and do 15 of these. So hold for 5 seconds, do 15 repetitions, and you can do this at least 3 times a day, but even more than that. And again, this can be done as a starting point with any rehab program. Really important to really feel that tightening when you tighten your quad and keep your heel on the ground when you're doing that. The second exercise is called a terminal extension. So leave whatever you put behind the knee there, so it's still bent, but in this instance we're going to move the leg up and down. So what you do is leave what's there with it bent, and so I'll put my one hand underneath there, and then pretend like my hand's out here in the air, and what Ashley's going to do is touch it with her toes, straightening her leg. So lock your leg out straight, raise up and hold it for a 1 count, so 1001, then back down. Then up and straight, 1001, then down. Up and straight, 1001, and down. Important things are just make sure you get your leg all the way straight, okay, so it's locked all the way, and then it's not hurting when you do this, okay. I'll take my hand away, but you want to do up to 30 repetitions like this. If you can do 30 repetitions and 3 sets, then you can start adding some weight to the ankle, and you can do that a number of ways. You can get a Ziploc baggie and put some sand in it, or some coins, or some rocks, or whatever, to put over the ankle when you do this exercise. Always be able to do at least 15 of these with whatever amount of weight you put on your ankle, and stay between 15 and 30 repetitions. When you can do 30 reps, then you can increase the amount of weight back to 15 and work back on up to 30 again. This is a really good way to strengthen, again, this vastus medialis or VMO, and it starts to engage the rest of the quadriceps when you're doing it. Again, don't do it through pain, and you just do it until your leg fatigues. So after 16 or 17 reps, if it's tired, give it a little bit of a break, and then try doing it again. The third exercise is called the Muncie method exercise, and it's specifically designed to make this muscle on the inside part of the knee work better. It doesn't make it stronger necessarily, it makes it contract better and fire better. So as it fires, it helps to pull the kneecap over this way and track, and it actually counterbalances this muscle over here. The positioning of your body is the thing that makes this work like it does. So what Ashley's going to do, we're going to exercise this leg. So what you'll do is bend this one up, bringing your foot right to where this knee is, okay? And then what you want to do is lean forward as far as you can comfortably go. If you get all the way to your knee, that helps isolate this better. Then rotate this leg out, walk it down, hold it for a 1 count, 1001, then raise it an inch off the ground, so right up to here, and hold it for 5 seconds. 1, 2, 3, 4, 5 will go fast, and back down, and repeat those steps. Just let it relax, rotate out, walk it down, hold it for 1 second, and off the ground, an inch, hold it for 5 seconds. Go through the same thing, and you want to lean as far forward as you can comfortably go. Now a lot of times it's kind of hard for people to do leaning all the way forward when they first start this exercise, so maybe you lean back a little bit so you can just get the exercise done. As you get stronger and stronger, you'll be able to lean forward farther and farther to where you're hugging this knee. And again, make sure you lock this knee down, raise it up, hold it for 5 seconds, And all you need to do is 20 good ones a day. 20 a day, that's all. If you add it up, it's only about 2 minutes worth. So it's a really easy exercise to accomplish. Your back bugs you a little bit when you're doing it. You can lean against a wall when you're doing it. Just remember the steps. Lean forward, rotate your leg out, walk your leg down, raise it off the ground, and hold it for 5 seconds once you're off the ground. A real key is making sure your leg's rotated out, and on this leg it's, just remember driver's training, 10 o'clock and 2 o'clock. It's either in the 2 o'clock position, or if the other leg, it's in the 10 o'clock position when you're actually raising it off the ground. This is called the Muncie method. It's a more advanced exercise for the vastus medialis, and if you want to have a well-functioning muscle, this is really important one to be able to do. You can actually test how strong that is or if it's working well by if you can do this exercise leaning all the way forward or not. Thanks.